So one of the issues that we talk a lot about is mental health, right? This is a national issue. Frankly, I think it's a worldwide issue. And we continue to take that challenge head on. When I came into office, the state had a mental health system that was fragmented. It was designed by bureaucrats. It didn't work for families. And we called it the unspoken crisis of our time. And unfortunately, that had only been exacerbated by the COVID pandemic. We set out to dramatically transform the entire mental health system, not just a piece of it here, not just put a little more money in there, but really transform the system to acknowledge that it is 2022. And to do things like it's 1985 doesn't make any sense, and it doesn't deliver results. And as we came through last year's COVID emergency order, I immediately issued another executive order, if you remember, and we just simply called on direct action to ensure that individuals in the mental health crisis, especially kids, receive timely and appropriate medical care. Simple statement, something everybody can agree on, but you can't just have a blue ribbon commission. You can't just write an executive order and tuck it away in a drawer somewhere. So a key piece of that transformation effort, as a lot of us know, is to increase capacity in our community-based services. Getting your services, getting your mental health supports, getting a lot of your healthcare supports in your community is simply a better way to do it. So that means providing access to mental health care for children and families before they find themselves in the crisis, before they have to walk into that emergency room. So let's talk about a couple of our successes, and I think they set a model for where we go. As a lot of folks know, we recently signed a purchase and sales agreement to buy Hampstead Hospital. It's a transformational investment to provide dedicated services specifically for New Hampshire's kids who need and deserve access to high-quality mental health providers. Just last month, we doubled down on our emergency on-demand access to mental health, so when you're in a crisis, you don't have time to wait. It isn't something that you want to study. When you're in the middle of a mental health crisis, we shouldn't be asking people to Google supports. So now we have our mobile crisis support, a 24/7 crisis call center. Over the last year, we invested millions to promote youth activities as well, not just what we do in the classroom. We have great social emotional learning programs in the classroom. We're working with kids to understand some of the pressures that can be on them and on the system and how to work through it. We're doing it through our summer camp programs outside of the classroom with kids, something that we had never even tried before, but had tremendous success with. In the next few weeks, Commissioner Shibinette and I will be bringing forward another, I think, historic opportunity for a public-private partnership that will, for the first time, provide New Hampshire with an adequate number of crisis beds for those who are most in need. Making investments in 2 brand new mental health hospitals in this state will have a profound effect, not just creating access to the beds, but also by opening the door and getting a level of workforce that we've never seen in mental health, a level of specialization that we need here in the state. We now become one of the most attractive places on the East Coast for mental health workers, for that workforce, for new programs and new ideas. And these investments are going to be coming. I hope to get everybody's support. We're not done. Just because we're investing in these new hospitals, we're taking better community services, we're making it a little easier for someone in that moment of crisis in their home to access help. We can't just rest on that. There's going to be a lot more ideas that come to the table. Every one of those ideas has to be put on that table. Every one of those ideas has to be listened to. Because whatever we design and invest in today, we can't do what we did 3 decades ago. Make fundamental change and then just kind of rest on our laurels, sit back, go on to the next thing. The mental health challenges that our country and our state are going to face are going to be here for some time. The door's open, it's a community solution, it's a 10-year mental health plan that was designed by families, not bureaucrats. Think about that for a second, right? We didn't just have bureaucrats, right? We brought in the families to do it. That was hard, it was a lot of hard work. But allowing those ideas to come on the table opened our eyes to a world of opportunity, problems, challenges. We're taking them head on. So there's a lot to do, and all I ask is what I think everybody in this room can agree with, that when it comes to mental health, we have the chance. Let's get this thing done.